Hi, welcome to Professional Certifications channel. Let's break down RHIT exam preparation, one topic a day for focused and effective learning. Today's topic is coding compliance.
Definition: Coding compliance in healthcare refers to the adherence to established coding guidelines, rules, regulations, and standards when assigning medical codes for diagnoses, procedures, and services provided to patients. It involves accurately translating clinical documentation into standardized codes using systems such as ICD-10-CM, International Classification of Diseases, CPT, Current Procedural Terminology, and HCPCS, Healthcare Common Procedure Coding System. Coding compliance is crucial for ensuring proper billing, reimbursement, regulatory compliance, and reducing the risk of audits or penalties.
Key features of coding compliance. 1. Adherence to official guidelines. Coding compliance requires healthcare providers and coding professionals to follow official coding guidelines, such as those issued by the Centers for Medicare and Medicaid Services, CMS, the American Medical Association, AMA, and the World Health Organization, WHO. This ensures that codes are assigned consistently and accurately. 2. Accurate and complete documentation. Proper documentation is the foundation of accurate coding. Coding compliance requires that medical codes reflect the services provided and are supported by detailed and complete clinical documentation, including physician notes, diagnostic results, and treatment plans. 3. Regular audits and monitoring. To maintain coding compliance, healthcare organizations conduct regular audits and reviews of coding practices. Audits help identify potential errors, ensure adherence to guidelines, and detect areas needing improvement. 4. Education and training. Ongoing education and training for coding professionals, billing staff, and healthcare providers are essential to ensure compliance with the latest coding guidelines and regulatory updates. This training helps reduce errors and maintain up-to-date knowledge of coding standards. 5. Compliance with payer requirements. Coding compliance also involves understanding and meeting the specific coding and billing requirements of various insurance payers, including Medicare, Medicaid, and private insurers. Each payer may have unique coding rules and coverage policies.
Importance of coding compliance. 1. Accurate reimbursement. Accurate coding is essential for ensuring that healthcare providers receive proper reimbursement for services rendered. Errors in coding can result in denied claims, underpayments, or overpayments, which can affect the organization's financial health. 2. Regulatory compliance. Coding compliance helps healthcare organizations adhere to federal and state regulations, such as those outlined in the Health Insurance Portability and Accountability Act, HIPAA, and CMS guidelines. Non-compliance can result in audits, fines, penalties, and loss of accreditation. 3. Prevention of fraud and abuse. Coding compliance helps prevent fraudulent billing practices, such as upcoding, assigning codes for more expensive procedures than were performed, and unbundling, separating components of a service that should be billed as one. These practices can lead to legal actions and penalties under the False Claims Act. 4. Improved patient care. Accurate coding supports quality care by ensuring that clinical documentation accurately reflects the patient's condition, diagnosis, and treatment plan. This helps providers deliver appropriate care and track patient outcomes. 5. Audit Preparedness. Coding compliance ensures that healthcare organizations are prepared for audits by government agencies or payers. Proper documentation and accurate coding reduce the risk of penalties and the need for corrective actions following an audit.
Challenges in coding compliance. 1. Constantly changing guidelines. Coding guidelines are updated regularly, with new codes being introduced and changes made to existing codes. Staying up to date with these changes requires continuous education and vigilance. 2. Complexity of coding systems. Coding systems like ICD-10-CM and CPT can be complex, with thousands of codes to choose from. This complexity can lead to errors in code selection, especially in cases where multiple codes apply or coding guidelines are unclear. 3. Incomplete or inaccurate documentation. Coding professionals rely on clinical documentation to assign codes accurately. Incomplete or unclear documentation can lead to coding errors, which in turn affect billing and reimbursement. 4. Payer-specific requirements. Different payers have unique coding and billing requirements, making it challenging for coding professionals to stay compliant with all payer rules. Inconsistent payer policies can result in claim denials or delays. 5. Resource constraints. Smaller healthcare organizations may struggle to allocate sufficient resources for coding compliance activities, such as hiring trained coding professionals, conducting regular audits, and providing continuous education.
Best practices for ensuring coding compliance. 1. Implement a coding compliance plan. Develop and implement a formal coding compliance plan that outlines policies, procedures, and guidelines for accurate coding practices. This plan should include protocols for addressing coding errors and ensuring continuous monitoring. 2. Conduct regular audits. Perform regular coding audits to identify errors, assess compliance with coding guidelines, and determine areas where improvements are needed. Audits should cover coding accuracy, completeness, and adherence to payer-specific rules. 3. Provide ongoing education and training. Ensure that coding professionals, billing staff, and healthcare providers receive continuous education on coding updates, regulatory changes, and best practices. Education helps reduce errors and improve coding accuracy. 4. Engage with clinicians for accurate documentation. Work closely with healthcare providers to ensure that clinical documentation is complete, accurate, and sufficient to support proper code assignment. Education on the importance of detailed documentation helps facilitate compliance. 5. Utilize technology for coding assistance. Leverage coding software, clinical decision support systems, CDSS, and electronic health records, EHRs, to improve coding accuracy and streamline the coding process. These tools can help identify potential errors, flag incomplete documentation, and ensure correct code selection. 6. Monitor payer requirements. Stay informed about the specific coding requirements of different payers, including changes to policies and coverage rules. Establish clear communication channels with payers to address discrepancies and clarify coding guidelines.
Future trends in coding compliance. The future of coding compliance will likely involve the increasing use of automation, artificial intelligence, AI, and machine learning to assist coding professionals in identifying the correct codes and ensuring compliance. AI-powered coding tools can analyze large volumes of clinical data, detect patterns, and recommend appropriate codes, reducing human error. Additionally, the shift towards value-based care and population health management may influence the development of new coding standards and practices.
Conclusion: coding compliance is a critical aspect of healthcare operations, ensuring accurate coding, proper reimbursement, and adherence to regulations. For RHIT exam aspirants, understanding the definition, importance, challenges, best practices, and future trends of coding compliance is essential for supporting the financial health of healthcare organizations and maintaining the integrity of health information management.